Hey, Jason Tushman back here with Spot On Patient Acquisition. Today we're going to talk about personal follow-up and how important it is to the patient acquisition process. Over the last year, we spent a lot of time talking about technology and how to make yourself scale, how to make things happen faster, and also how to do them smarter, okay? This is about being smarter, okay? The personal touch is still incredibly important in your patient acquisition process, and it will absolutely drive attendance rates and conversion rates. And here's how we believe you can productively implement this into what I know is a busy situation for your office. First, post-schedule. After an appointment's been scheduled with a high-value purchase or a high-value potential consumer, you want to make a quick 10 to 15-minute call to them. You should have this scheduled into your follow-up process. You want to develop a relationship with them, okay? That's the number one intent of this initial phone call. Then you want to have an understanding of their interests. What is driving them to consider this aesthetic procedure in your plastic surgery office, in your dermatology office? You want to understand their timing, okay? When are they actually thinking about having this occur? And then you want to understand their financial capabilities, okay? Are they going to be paying this with cash? Are they going to need financing? Is it a little bit of both? At least understand this. This can be done with a good series of questions in 10 to 15 minutes under a scheduled process, okay? It's going to help you get better, a more informed consult, and it's going to develop that relationship. Now, the next point that you want to bring in the personal follow-up outside of the obvious one of the actual consult itself is post-consult. 2 to 3 days after your consult, instead of sending an email right away, instead of sending a letter, which I hope you're not doing through the mail in today's world, okay, make an actual phone call first, okay? Call that consumer. Have you answered all of their questions, okay? Are they interested in getting on the calendar now? Is there any financial issues they want to review? As well, something that's really important is understand if they've been anywhere else. Do they have any questions on why you're different versus a competitor? Okay, this gives you the opportunity to essentially vet your competition in the eyes of that consumer if they saw anybody after their consult with you. Look, as a conclusion, make this a part of your standard operating process. Know who's going to do this, know when it's going to happen, okay? Know who's going to do this, know when it's going to happen, and invest up front. If you invest this little bit of personal time up front, you're going to drive attendance rates, you're going to drive conversion rates, and you will have a much, much more efficient patient acquisition process. Hope this helps you. Look forward to seeing you next time.